This instructional video is designed to assist you with preparing for your colonoscopy using an extra dose of the bowel preparation formula, MiraLAX. Please refer to the colonoscopy preparation instruction sheet and other materials provided by our scheduling personnel for details regarding important times and dates pertaining to your procedure. At least 5 days prior to your colonoscopy, please be sure that you have arranged for someone to drive you to and from the procedure and have received instructions from our office. You will need to purchase two 238-gram bottles of MiraLAX or generic over-the-counter polyethylene glycol 3350, along with two 64-ounce bottles of Gatorade or a similar sports drink. You will need to purchase the laxative Bisacodyl, and you will need to purchase infant Mylicon gas relief drops. 5 days prior to your colonoscopy, you should stop taking supplements, iron pills, and medications containing oil. Make sure you have received instructions on what to do with diabetic medication, weight loss medication, blood thinners, and implanted heart devices, such as defibrillators and pacemakers. If you have not received instructions about the bowel prep, how to manage blood thinners, diabetic and weight loss medication, or need to cancel or reschedule, contact the office. If you have constipation, take one 17-gram capful of MiraLAX in 8 ounces of water up to 3 times per day, as needed, to maintain daily soft bowel movements. You may use your usual laxative as needed as well. And if you have severe constipation, contact the office. 5 days prior to the colonoscopy and until the procedure, you must consume a low-fiber diet. The importance of following a low-fiber diet during this period cannot be overstated. In this chart are examples of low-fiber foods which you are allowed to take in the days preceding your colonoscopy. You will find the same information on the form seen here, which is part of your colonoscopy prep instruction packet. Acceptable types of food include non-whole grain bread, pasta, crackers and cereals without seeds or nuts, well-cooked and canned vegetables and fruits that do not contain seeds, dairy products, meats and other protein sources, and various other fats, confections, condiments, and beverages. Raw fruit with seeds, corn and popcorn, beans, and other seeds and nuts, on the other hand, are not allowed. If you are diabetic, you will need to modify how you take your diabetes medication. Please refer to the instruction sheet entitled Diabetic Medication Instructions about what changes need to be made prior to your procedure. If you take weight loss medicine, please refer to the instruction sheet entitled Weight Loss Medication Instructions about what changes need to be made prior to your procedure. For the rest of the day, you should consume a clear liquid diet. Do not eat solid food. Examples of clear liquids include apple juice, green grape juice, broth, sports drinks like Gatorade, popsicles, Jell-O, coffee and tea without cream, milk, or dairy substitutes. Even though they are clear, do not consume liquids that are red, blue, or purple, and do not drink alcohol the day before your colonoscopy. At 4 p.m. the day before your colonoscopy, take 4 5-milligram tablets or 20 milligrams of Bisacodyl by mouth. At 6 p.m. the night before your procedure, mix the first 238-gram bottle of MiraLAX together with 64 ounces of Gatorade. Next, drink 1 8-ounce glass every 15 to 20 minutes as tolerated. Finish all 8 glasses. After you start drinking the bowel prep, you will begin to experience the urge to defecate and can expect to have diarrhea. This is normal. It may take several hours before you have the first of many bowel movements. Loose bowel movements may go on for a couple of hours after finishing the prep. Mild abdominal cramps, bloating, and chills may also occur. You may also experience nausea and sometimes vomiting. If you have nausea, take a break from drinking the prep. When the nausea goes away, resume drinking the prep, but try drinking it more slowly. Drinking the prep through a straw, adding ice, or adding a flavored beverage or sugar-free drink mix such as Crystal Light may make the prep more palatable. Early in the morning of the day of your procedure, take your usual prescribed medication except for blood thinners, insulin, or oral diabetic medication unless you are told otherwise by your doctor. You may continue to consume a clear liquid diet. 6 hours prior to the check-in time on the day of your procedure, mix the second 238-gram bottle of MiraLAX together with 64 ounces of Gatorade. Next, remove the syringe from the box of MiraLAX and fill with 0.6 milliliters of MiraLAX. Add this to the MiraLAX prep mixture. Repeat this step 4 more times for a total of 5 syringe fills, which equals 3 milliliters of MiraLAX. Next, drink 1 8-ounce glass every 15 to 20 minutes as tolerated. Finish all 8 glasses. It is important that you do not stop drinking the prep even if your stool is clear, as fecal matter comes out intermittently despite the fact that you have not eaten any food. The following pictures are meant to illustrate what we refer to as an adequate colon cleanse, which is seen at the top row, versus an inadequate colon cleanse seen at the bottom row. The picture at the top right is exactly what you want to see in your toilet bowl prior to the procedure. It shows clear, lightly colored, watery stool and corresponds to the picture on the top left, which is what the inside of the colon looks like when your stool is clear, yellow-tinged, and watery. As you can see, the lining of this patient's colon was free of debris that can interfere with the detection of polyps and other abnormalities. The picture on the bottom right shows stool that is dark, has some solid material, and you cannot see through it to the bottom of the toilet bowl. The pictures on the bottom left show that some parts of this patient's colon are not visible because of the presence of stool. The middle picture in the second row shows a polyp that was found when the residual stool was removed. This polyp could have been missed. Other polyps may be missed as well when stool that is solid, thick, or full of debris cannot be suctioned out of the colon. 4 hours prior to check-in time on the day of your procedure, stop drinking all liquids including the bowel prep. It is important that you remember to bring your medication list, a driver, your photo ID, and insurance card. If you wear eyeglasses or use hearing aids, bring those as well. Please also remember that you cannot drink alcohol, drive, or operate other heavy machinery for at least 12 hours after your procedure. After you arrive at the facility where you are having the colonoscopy, check in at the front desk, ask your driver to stay on the premises for the duration of your procedure, and only bring essential personal belongings to the procedure area. This completes our colonoscopy instructional video. I hope you have found it helpful. If you have questions or concerns that have not been addressed here or in the materials provided to you, please contact the office for assistance. Thank you.